available for viewing on our website, as will the slides. So when this webinar is over, I'm going to I'll send you a link to the recording. I'll send you a copy of the slides, and I'll make sure that you're also sent your certificate of attendance. And all of those things, except the certificate, will live on our website. And this webinar is supported by SAMHSA, who is our funder. We are 100% funded by the Substance Abuse and Mental Health Services Administration. I do want you to know that the views, policies, positions, and comments that are shared on this webinar do not necessarily represent the views and policies, positions, and opinions of SAMHSA. Like I said, I am with the Southeast Prevention Technology Transfer Center. We are one of 10 PTTCs across the US. We serve 8 states in the Southeast region, and we are located at Wake Forest School of Medicine. And I'm going to hand it over to one of our co-directors, Dr. Mark Wolfson, who's going to set the stage and introduce our speakers today.
Thank you so much, Kristen. Can you hear me okay? Terrific.
Yep.
Well, we are really excited about this webinar today here at the Southeast PTTC. And we're excited because the focus is on, one reason we're excited is because the focus is on alcohol policy, and that's something that we care a lot about. It's the focus of quite a bit of our research at Wake Forest and University of California, Riverside over the years. But it's also important to us because we know there's a gap in the prevention field. There are a number of evidence-based policies, both at the state and local level, that have been shown to be very effective that are underutilized in the field of prevention. Things like alcohol outlet density, regulating density, social host ordinances. And we also know that alcohol is a huge problem in the United States. More than 95,000 deaths in the US each year, and it's the leading cause of preventable death. So we were really intrigued when we started talking about state policy alliances as a vehicle for building state capacity and local capacity around alcohol policy. So we're delighted to have 3 fantastic speakers today to talk about this topic. The first that I'll introduce is Michael Mumford, who's the Director of Programs at Fayette Factor, Inc., and also Drug-Free Fayette Substance Abuse Prevention Coalition, which is located in Fayette County, Georgia, a suburb of Atlanta. And Michael is involved with SAMHSA's Opioid Response Network. But most importantly for what we'll be talking about today, he helped launch the Georgia Alcohol Policy Alliance. So you'll be hearing more about that. The second speaker, and this is not in the order that they'll speak, but just the order in which I'm introducing them, is Dylan Ellerby. So Dylan is an expert in community level change, policy advocacy, and the prevention of excessive drinking. He's worked as a research associate both at University of North Carolina at Greensboro, as well as Wake Forest School of Medicine. I remember those days well. And he has coordinated the North Carolina Preventing Underage Drinking Initiative for 15 years. Works as a trainer for CATCA. And most germane for the webinar today is he's involved in both the U.S. Alcohol Policy Alliance. He's the treasurer and a member of the board of directors, and also is the founder of the North Carolina Alcohol Policy Alliance. And then finally, we have Michael Sparks, who is an alcohol policy specialist and the president of Sparks Initiatives. Has also trained widely throughout the country for CATCA and other groups. Has worked with us at Wake Forest and Johns Hopkins, and is the co-chair of the Scientific Advisory Board of the U.S. Alcohol Policy Alliance. So I think you've seen the learning objectives for today. We have a great, here they are. So describe the mission of the U.S. Alcohol Policy Alliance, as well as organization and membership. Understand what roles state alcohol policy alliances can play in local and state policy development, and explain the key steps and considerations in forming a statewide alcohol policy alliance. So thanks to our speakers, and let me hand it off first to Dylan and Kristen for a poll.
Yeah, if you would, please make sure you put your name. Thank you, Mark. Put your name and organization and your role with that organization in the chat. There you go. I see some of you are doing it. And let us know, how long have you been working in the ATOD prevention field? See, we've got 7 years, 12 years. Sandy's been 11 years. So keep that coming. We tried to do polls, but for some reason, WebEx didn't want to participate in that. So in the chat, if you would, let us know, to what extent have you been active in some sort of state or local level policy work? A lot, some, not much, or none at all. We've got a lot, not much. I'm seeing some, not much, some. Okay, so we're getting some experience in there, so do keep that coming. So it looks like, esteemed panelists, we've got, everyone's kind of saying some. I haven't seen any none at all yet. Welcome, Jennifer, Jim. So not much. We're seeing a little bit of not much, but again, none at all. So we're sort of around in the middle there. Wow, and Cindy's been in ATOD for 21 years. All right, and we have
there's a lot.
There's someone's got a lot, Mina, and then a not much. So we're kind of running the spectrum, but we're all kind of around. Everyone seems to be right around the middle there, to having some experience or not much experience. 18 years, way to go with you, way to go, Cindy. All right, well, I am going to go on and advance the slides. You guys keep it going in the chat. And by the way, feel free to post any questions in the chat, and I will scan through those as we near the end, because there will be a Q&A period at the end with our panel. So Dylan, I'm gonna go on and turn it over to you now.
Thanks, Kristen. Can you hear me?
Not well, no.
Oh, really? Okay. Is that better?
Much.
Yes.
Okay. So let me just talk a little bit here first about the United States Alcohol Policy Alliance. You see our mission and vision up here on the board. As Kristen said, my role with the U.S. Alcohol Policy Alliance is as a founder, long-term board member, current treasurer. Our mission is to translate alcohol policy research into public health practice to prevent and reduce alcohol-related harm. And our vision is a nation free from alcohol-related disease, death, and injury. Of course, a very lofty one, but setting our sights high. We want to ensure that local and statewide organizations are engaging in alcohol policy initiatives, and that those folks have access to the science that's out there, resources and technical assistance, as well as offering support for organizing efforts. Those are the things that we're trying to do as a U.S. Alcohol Policy Alliance, this webinar being within that kind of purview. So this is our board. Nicole Holt is serving as our chair, and she's from Texas. Alicia Sparks is our vice chair, located in California. Mike Tobias is our secretary in Michigan. And then rounding out the rest of the board is Guy Williams, Tiffany Hall, Mike Marshall, Rick Collins, and Michelle. This is our scientific advisory board, co-chaired, as we said at the beginning, by Michael Sparks, who's here on the call, as well as Tracy Toomey. And then you can see the rest of the distinguished names that we're very lucky to have as part of our scientific advisory board. So some of our activities, kind of to summarize over the last year, this is of course a partial list. We are an all volunteer organization, or I should say mostly volunteer organization. We had some paid interns over the summer who we were very fortunate to have and did great work. We have conducted 4 interactive dialogues. Would love to see in the chat box if anybody has been on any of our interactive dialogues. You can put yes in the chat box. If not, and you're interested in learning more about that, we'd be happy to share. Those are sort of kind of doing things a little bit differently and offering discussion groups as opposed to the typical webinar format. So we've done 4 of those. We've got a 5th coming up. We have disseminated monthly State of the Alcohol Policy Field newsletter. So if you're not on our newsletter list, please reach out to us. Let us know. info@alcoholpolicy.org is the best way to reach us. We provided the U.S. response to the WHO Alcohol Action Plan, which we see as a very important role that we serve, sort of representing the U.S. In the kind of global dialogue on alcohol and alcohol policy. We're very proud of this one, a funded partner in the CDC Alcohol Policy Technical Assistance Center, which is kicking off here shortly. Very excited to be playing a role in offering further technical assistance to the field on issues of alcohol policy. We provided training and technical assistance to other state alcohol policy alliances. You'll hear from Michael Mumper a little bit later. He and his organization are one of the recipients of that training and technical assistance. We've sent out action alerts on such issues as the dietary guidelines and the White House Alliance with Budweiser. Go ahead and move on. And our member or board member states, so the states that were represented either with an alliance or with a board member, are Texas, North Carolina, Michigan, California, Oregon, Hawaii, Alaska, New Hampshire, Nebraska, and Georgia. We are always looking to expand that list. And so we're really hopeful that there's some folks on this call that are interested in getting involved with the U.S. Alcohol Policy Alliance by forming structures in your states. So which Southeast states have a state alcohol policy alliance? We have the North Carolina Alcohol Policy Alliance and the Georgia Alcohol Policy Alliance, but there is, thank you, Kristen, lots of opportunity in the Southeast. You can see Georgia, Tennessee, West Virginia, Florida, or I should say Kentucky. I'm having to name states and then I don't see them there, so sorry for that mistake. But yeah, there's a lot of opportunity, of course, here in the Southeast, and excited to have other folks potentially become part of the U.S. Alcohol Policy Alliance.
Okay, so we do want you to please post in the chat, answer this question. Is there a group in your state that comes together to discuss, plan, advocate for state level alcohol policy? And there, look at the options. Yes, and I know who they are, or I'm not sure that's a good question. That would be B. There's one, so I'm not sure. C, not that I know of, and D, no, there is not a group yet. So we're getting some yes, I know who they are, and lots of not that I know of. And then some I am not sure. Those of you who are in North Carolina or Georgia should say yes, and I know who they are. So we've got some I'm not sure, that's a good question, and yes, I know who they are. Thank you for participating in that. I'm gonna go on and advance the slides. Thank you, Shamika and Virgil.
So this is Michael. I'd like to make 2 points around these organizational benefits. We at the Alcohol Policy Alliance are interested in having you affiliate with us, to be right up front. We feel we started that organization as volunteers, continues to be volunteer at this point, in order to create a sort of safety net across the country where states have power when they come together and either are working on federal legislation, federal alcohol taxes, trying to change the classification of alcohol pops. There's a lot of national alcohol policy issues that if we had a large number of state alliances that were weighing in on that, we would have more power. And so there's just value to creating a state alliance just for the sheer utility of participating in a larger group of organizations that can speak nationally together, but also to gain and have knowledge and transfer knowledge across states in terms of some of the bills and issues that are going on. The U.S. Alcohol Policy Alliance at this point is beginning to serve as the hub of that wheel of state alliances, and hence our interest in having you become a member of the alliance. There are certain benefits that come to that in terms of discounted registration to Alcohol Policy 19 and other alcohol policy conferences. We'll say more about that, the conference, at the end of the session. You often get first knowledge of these interactive dialogues that a number of you I noticed in the chat box have been attending. And, those are powerful ways to connect with each other as you're working on key issues. And increasingly, the Alliance is focusing on equity, and we're looking at ways to really infuse equity and social justice into the work that we're doing as a field. Michael Mumper will say more about this when he does his presentation, but we also provide technical assistance. And so it's not uncommon for us to get emails, almost every day asking for advice or resources, training. And so we are in that role, as you notice from our objectives of helping to translate what best practices in the research into how do you do this work on the ground. And so for us, that's a critical piece of the role that the Alliance plays. You saw our advisory board, but our advisory, the folks who are doing this work in the field, who you might roughly call the experts, aren't just limited to the advisory board, the board members, although those are some of the folks in the field who are deeply involved in this work. But we have relationships with broad numbers of people, both on the research and practitioner side, with whom we can connect you if you're part of the organization. We're also increasingly involved in global work, the work of the WHO, the World Health Organization, and we communicate and participate both in developing their conference materials and incorporating their science into the translation of our work as well and disseminating that. We keep you updated what's going on both through our website and our monthly emails that are put out by the board. Next slide, please. And part of what we want to, Mark mentioned this, I think, in the beginning when he was speaking, is wanting to frame this question about why is it important to start a state alcohol policy alliance. And there are really just a lot of reasons, but at this point, we just want to talk to a few of them. The pandemic, I think, for many of us have driven home the gap in power between the role of the industry and our alcohol policy field. And that gap took a major hit as we saw state after state enact emergency proclamations, new rules, and essentially have made those permanent over our efforts to try and have them rolled back. And so in the last 18 months, we've seen a systematic rollback of the regulatory system state by state by state that we've worked years to create. This notion of creating an alliance is a bulwark against having the industry be able to just ramrod through alcohol policy. So it's an important piece of both playing defense at the state level and making sure the bills that should not go through don't go through, but also playing offense and trying to work on introducing our own bills that protect public health and are best practice. So, what happens both at the state level as bills are adopted often influences then what happens at the local level and what we can do at the local level. We're all familiar with preemption issues, and so this notion of trickling down where states enact bills that then influence what we can or cannot do at the local level is very, very important. Next slide, please. We keep our eye on the industry. We keep our eye on policies. And in that way, we communicate and with our alliances are constantly feeding them information about things they need to be paying attention to that come across our radar that may affect their states or maybe national policy. So that's a really important piece as someone's minding the store, if you will. And the other critical piece around creating an alliance is that the state alliances are developing the capacity to support local alcohol policy work. And this is a really important role. So again, we'll speak to some of this when we have our case studies, but we are, as we strengthen the national capacity to respond to alcohol policy and initiate alcohol policy, we're also pushing that expertise down to local coalitions, of which many of you are associated. So that state level power building and that local level power building go hand in hand. And we think that being part of the U.S. Alcohol Policy Alliance gives you a leg up in that work. And then ultimately connecting with the alliances. Sorry, that's fine, go ahead. So some of the kinds of work that we've been focusing on, really looking at COVID-19 policy. This is on everybody's mind and will continue to be, I think, on our mind as we move forward with this. Looking at alcohol to go. This is part of that state rollback of the regulatory system that we talked about. We are working and have created sort of ad hoc focus groups, and not focus groups, but discussion groups and networking groups focusing on alcohol taxes. You know, a number of us had state bills last year, and we were both involved in the thinking about those bills together, and then the post-mortem on those bills when they did not get passed and adopted. We've been working and supporting alcohol density work for some time. This is a priority for the organization and quite frankly, a passion for many of us. Sort of looking at the deregulation and the rollback in this attempt to change the three-tier system. You know, that middle section of keeping the wholesalers in the second tier is an important piece of our prevention work. Three-tier systems, it works in our favor and you know, attempts to decrease the concentrated power in any one tier. Civil social hosting and civil social host laws and others. So those are some of the, you know, critical issues that we've been speaking about over the last year and will continue to look at this year. Next slide, please. So a question for the chat box. As you think about, you've heard a little bit about what we're attempting to do to build national power, to build support the ability to influence state alcohol policy, to build the capacity through building state alliances to support local alcohol policy. There are many of you who have been in this chat box noting that you've been doing some work at the state level already. We're interested in a general chat box discussion of how do you think your state might benefit? What's going on in your state? How would creating a state level alliance potentially benefit where you are in your state? So
I'm looking for responses in the chat. How could your state benefit from a statewide alcohol policy alliance? Throw some ideas into the chat. And welcome Alicia Sparks, the vice chair of USAPA. She's answering some questions live in the chat as well. But let us know, how do you think your state could benefit from a statewide alcohol policy alliance? By connecting with other states, we'd have more power nationally. Be helpful to have more than just myself trying to affect policy, says Colleen. Alcohol affects so many different partners' missions. That is such a good point right there. The state needs more information connecting with others, bring visibility and science to the legislature on effective alcohol policies. Good point, Jim. Michael, you're seeing these. Do you have any?
Yeah, I think
thoughts?
one of the comments that caught my eye was that not having to do this work alone. And I think that's something that we often hear is that there's one or two people who are paying attention to this at the state level, and they end up being the one who may go testify. They might write letters. But what we know, and we understand this, is that there's power in numbers. And while it's great that there's one person who's beginning to focus on this at the state level and who's maybe tracking and monitoring alcohol policy, maybe has time to send out information to other folks when they need a letter of support or opposition, whatever that may be. But translating that one or two or three people who are kind of doing it informally into a vehicle creates the impression on the part of legislatures that there's a there. And so that's an important piece that I think to take the sort of small efforts that are already going on in states and build out a more comprehensive, and I'm going to use the word formal. I don't necessarily mean formal in the one that you have to create a 50C3, but give yourself a name, create a sense that there's a presence there, spread out the work. You know, that's part of what these alliances can do. And then, you know, connect to the U.S. Alcohol Policy Alliance so we can bring you into the sort of the group and get that support as an organization.
Yeah, there are a lot of comments about spreading out the work, and even Melissa commented on spreading out the burnout. So it's not on one group. Dylan, do you have any thoughts about anything you've read in the chat?
Yeah, I see Sandy referencing power, and that's such an important part of this. I think Michael, Michael talked a little bit about that, but that's what we're trying to do here, right? Is to at the national level have a powerful voice so that there is opposition to the industry and their extensive and very well-funded lobbying efforts. But then the same thing at the state and local level is just so important to build those structures so that there is a group of people, whatever that looks like, whatever that structure is, it's different in all of our states, that there's a group of people who know what they're fighting for, are well versed in the science, and are ready to take action when it's needed, to the point that the legislature becomes very accustomed to hearing from that group and knows that we can't just pass stuff in the dark of night and nobody notices and nobody cares. No, we do. We have to deal with these folks who represent an important constituency on the public health side.
Thank you. I love that point about not allowing him to pass stuff in the dark of night because people are now paying attention. Michael Sparks, you see anything else in the chat that you'd like to respond to?
No. Yeah, no, yes. I think
I know.
this notion of power is so important, and for me, these state alliances begin to, as I said earlier, close the power gap that really has broadened over the last 18 months between the ability for the industry to kind of have their way without pushback and our ability to hold the line on some of these very harmful alcohol policies that were passed. The dark of the night thing is interesting. Sometimes it's the dark of the night, sometimes it's the weekend. We saw a number of bills who looked great on Friday, this last legislative session, and by Monday morning they were dead. And I mean, literally looked great on a Friday. We were having conversations with legislators. We were talking with committee chairs. We'd already gone through some of these processes on alcohol taxes, for example. Here in Hawaii, it was a great example where we're always cautious, but as we were in on a Friday and talking with our author of the bill, we were all thinking, God, next week we have a committee hearing. We have a good shot at this. And by Monday morning, it was a dead bill. And we understand how that works. And while we weren't surprised, we were disappointed. And I think this is an area we have an alcohol policy alliance. It's 3 years old here in Hawaii. We're just getting started. People are beginning to know our name. But had we been around longer, had we been able to turn out more support, maybe we would or wouldn't have won that particular issue. But I think we could have kept it alive longer and just played stronger in the game. And this is a really important piece to this. So the power in the dead of night thing is very real.
Right.
I'm seeing a lot of
All right,
people to kind of reference some of the limitations that folks experience being part of organizations that have lobbying restrictions, whether that's that your organization receives restricted funding, whether that's federal, state, local funding that specifically says you cannot lobby with these funds, or county or state level employees. So there are restrictions on folks that are out there, and we could, Michael and I have done very lengthy trainings on that world and how to navigate that as a coalition or as an organization. But one of the important points that someone makes here in the chat box is that having a statewide alliance enables this voice to have a lobbying entity. So there's a group that can do that work that maybe some people, some coalitions, some employees of the county or state are not able to do. So you can feel confident that there's a group that's doing it. And so whatever your role is in helping form that group, you may not be one of the people who's part of actually lobbying, but you can feel confident that there is this entity or this organization that's able to lobby, able to move legislation forward, able to fight for what's important in this field. And so that's one of the reasons I think that whatever our role is in the facilitation or creation of that entity, it's really, really important for all of our states to have one.
Great. Thank you for addressing that really important point, because there are limitations on many of us. So I appreciate you bringing that forward. So let's move on. Michael, if you want to dive into the more of the nuts and bolts here.
Yeah, we're gonna hear from, again, Michael Mumper's gonna talk about a little bit of the process he used as he created his the Georgia Alcohol Policy Alliance when he does his presentation. But generally, there are some steps, and depending on where you are in your own state, if you've already got a group who's convening and talking about this, but really haven't put much structure to it, that's one thing. But for the moment, let's just, in looking at your chat box comments, assume that there is not really a group in place that considers yourself a state alliance. And really that first step is one of just having conversations with other people in your state who share your interests, who are interested in alcohol policy, not necessarily having done work at the state level, but just pulling together a beginning core of people who can spend the time necessary to reach out and create a broader group of folks who want to do something about this and begin to name yourself. I mean, there's this power in the name. There's also, we're moving into a new legislative session soon. And if you begin working on this issue now, for example, you may not be organized at the point where you have much to say next year as a group, maybe as individuals, but as a group around what bills may be coming down the pipe from the industry. And certainly probably not in a position to introduce your own bills as a organization, a state level organization. But one of the things that's important is to learn how to track what the industry is doing. And so just that very early learning how, and this is part of the technical assistance that Dylan and I and others have provided, just learning how to get into your state system and track bills. And if nothing else, use the vehicle to educate and send out the bills that are coming in the next session that affect the work that you're doing is an important first step. May or may not have it be in a position to take positions on those, but on those bills, but just letting people know what's happening. It's part of the education for those of us who are just getting into this state level arena. Eventually, and you're going to want to be taking a position on some of these bills. And it may be that you're playing defense first, because I think there will continue to be this year and ongoing attempts to roll back the regulatory system at your state level, to expand the powers of the industry to sell alcohol, to capitalize on its availability. And so it may be that you're playing defense first, just pushing back against those bills. Eventually, you're going to want to play offense, where you're introducing your own bills that are good bills. And when you're sort of in that place where you're feeling positive because you're both playing defense and playing offense. And sometimes the best defense is a good offense in this case, where you're also introducing bills because then the industry has to respond to you. Next slide, please. Creating an organizational structure is important. And alcohol policy, state alcohol policy alliances take many forms. Some incorporate, some are just a loosely knit group of people who come together monthly, who have working groups, but are not formal in the sense that they've got a formal structure. They call themselves, they have a name, they work together, they take positions, they represent themselves as part of an alliance. So what's important though is the function. The form of your alliance really needs to follow the function of what you're attempting to do. And so you want to be able to make fast decisions. When you're in legislative session, bills are changing quickly, amendments are made in hearings. Someone's got to be sort of in a position where they can pull that together for the group and perhaps have a small group who has the authority to make decisions. We have a small executive committee on the U.S. Alcohol Policy Alliance. We keep everybody apprised, but if we're in the middle of session and something happens on a Tuesday morning and we need to weigh in it by Tuesday afternoon, we generally can do that. Keep regular communication with your members. There comes a point when you use media, and we won't get into how you do that now, but that's media advocacy is a really important role in doing this kind of work, both at the state level and at the local level. So some training on that, and then ultimately creating those calls to action, rallying the members of your community to weigh in on these bills. And as you're moving through this, you're building relationships with state lawmakers. I mean, that's a really important piece of this. So much of this is that relational one-on-one. When you know your state lawmakers, when you just take the time to go in and introduce yourself virtually or in person as things kind of get back to normal, it becomes important for them to know your face, to know who you are, educate them about the importance of the science. And then those relationships begin to play off over time when legislators begin to reach out to your alliance for feedback on bills or call you up for support on bills. Next slide, please. And then whatever support you actually need. I've been a member of a state alliance in which we were all members as individuals. We did not have organizational membership. And for years we carried on like that by paying our annual individual dues. And we were completely free then as a group who received no outside money to do this kind of advocacy and policy work. So think about what vehicle you may want to use to create some, as Sue Thaw from CADCA will often say, hold a bake sale. You want some kind of resources in order to be able to do this work. If people need to fly to the state capitol, over time, you may be able to generate a little bit of a base of money where you can support someone who needs to do that kind of work. So we can help you think through this and join the U.S. Alcohol Policy Alliance. Become a member. It's a really important piece where you become part of a larger family. Thank you.
Okay, now we're going to hear a few examples of state alcohol policy alliances. We have one that you're going to hear from who's been around for quite a while, and then we're going to hear from kind of the newest kid on the block. So Dylan, I'm going to hand it over to you to talk about the North Carolina Alcohol Policy Alliance.
Sure, thanks, Kristen. You can go ahead and just advance to the next slide. So I remember, when I first started my career in this field, I realized pretty quickly that policy was where I wanted to spend a significant portion of my time, and felt like that was really where we could make the biggest difference for the littlest amount of time, resources, dollars, and so started spending a lot of time thinking about it, working on it on my own time, and then realized along the way, after meeting some national experts such as Michael Sparks and Diane Levy and David Jernigan and Jim Mosher, that we could form an alliance in North Carolina. So we had originally just sort of had a group of emails, and when things would come up, we would send out emails. So we've gotten a little bit more formal as the years have gone on, but not too much. We still are not a 501c3. We still don't have any funding. There's been multiple times that we've needed funding to pay for something, and we've had member coalitions and organizations donate, either make payments directly to that entity or to the alliance, and then make payments from the alliance. So there's a lot of different ways to do this. Ours is still an informal type of organization, but we've been around for 10 years. We're now at over 24 community organizations across the state. As we said, we're still 100% volunteer, but we monitor and track bills, and then we work to introduce bills. So we've introduced a number of bills over the 10 years that we've been in existence, and have also fought the bad alcohol policy bills that have been out there that we've been able to take action. So this is just an example of, or a couple examples of some of our kind of social media advocacy work that we do. This is our Twitter feed. Feel free to follow us at NC Alcohol Policy. We'll also share the U.S. Alcohol Policy. I think it's at U.S. Alcohol Policy. We'll share that Twitter handle as well, which is super useful. I find Twitter to be an interesting place. I think you can access elected officials more readily than you would expect if you tag them in a post. You also can access news networks. So we follow all of the different news networks in North Carolina, radio, TV, newspaper, blogs, because then they'll see, and they follow us back, and then they'll see posts when we make them. And so we've gotten some real news by creating kind of social media news, and by calling out lawmakers who are doing things that we don't agree with, or by asking lawmakers to do something. So just a quick summary of some of our various actions and achievements, and I want to make sure that it's understood that it takes a village, and so there are people, I can't see all the attendees here, but I know there's a number of North Carolina folks who are on here who have been a critical part of each one of these achievements that I'm going to talk about, and it's just so heartening and inspiring to see people step up at different times, and has been so much fun to be a part of it, to watch over the years that we've been on. We've helped defeat privatization of our ABC or liquor sales system multiple times. Clearly, there's erosion taking place in North Carolina and in other control states, but we still do have an ABC system where liquor is sold through government-run stores. Our biggest trials, our biggest one was probably in 2010, when Governor Perdue made it very clear that she was going to do everything she could to privatize our liquor sales system in order to deal with a state budget shortfall. Within about 6 months, we had her on the record saying that she didn't want her grandchildren to be walking down an aisle and looking to the side and seeing liquor bottles, that they belonged in government-run stores. And so that was a big victory for us. And then we also fought a pretty tough attempt at converting our sales system to private in 2019 as well. But it's always there. The specter always lurks in the background. We funded a legal paper on alcopop classification. If any of you are not familiar with alcopop classification, there's great work that has happened in Nebraska, California, Maine, other states on alcopop classification. You can look it up. You can reach out to us at info@alcoholpolicy.org if you have questions. But alcopops are these incredibly dangerous products that are available oftentimes in, single, I'm not going to say single serving, but single open cans at gas stations, convenience stores. They oftentimes contain the equivalent of 4.5 to 5 standard servings. They should be classified as spirits, not as beer or malt beverages. And so we've worked really hard on that over the years. We've not been successful, but we did have a really good paper written that we were proud of, that we were able to do again with an organization that's as sort of non-formal as ours is. So we're very proud that we were able to put that together. We defeated legislative cocktails to go in April or May of 2020. As most of you probably know and have experienced in your state, cocktails to go is now pretty much in all 50 states, as far as I am aware. And it started happening in most states in March, April, and May. In North Carolina, we were able to hold it off until December when the governor made it legal through executive order. And so we still fight that battle to this day, but we're successful for a number of months in defeating that from a legislative perspective. This is back a number of years ago. We helped stop the naming of a music venue, a prominent music venue, which is now known as the Red Hat Amphitheater. It was supposed to be the Bud Light Amphitheater, and so we worked with the ABC Commission and the city of Raleigh to defeat that, and we're proud of that. We have successfully advocated for, and this is a really important role that our ABC Commission serves and that many serve in your states, is what alcoholic products do we allow for sale in our state? We have successfully advocated for numerous products to not be sold in the state of North Carolina. Just a few examples here: powdered alcohol, Everclear, things like whipped cream alcohol. All of those things are not allowed to be sold in North Carolina because of the ABC Commission declaring it so, and the advocacy that happened behind the scenes. Okay. I think that's
all right. Thank you so much, Dylan. If anyone has any questions for Dylan, please put them in the chat and we'll bring them up at the end of the session. Now I'm going to hand it over to Michael Mumper, who is the lead for Georgia's brand new alliance. Michael, take it away.
Thanks, Kristen, and for Dylan and Michael for that great stuff. As Mark said earlier, I am also the coordinator of a prevention coalition in Fayette County, Georgia. So for a historical perspective, I've been in this field for about 10 years. The first 5, I operated under a single state agency block grant related to alcohol. And right at the end of that 5-year period, we were successful in adopting social host ordinances in our county. We really didn't know what we were doing. And if we have a longer conversation sometime, I'll tell you how that happened. And as far as I know, only about 6 of the 159 counties in Georgia have passed social host ordinances. So this is a theme I'll circle around later, that there's really not enough supportive policy work at the local level in Georgia, as I'm just finding out in the last year, and we'll come back to that as well. Then in the last 5 years, the coalition I work with got a drug-free communities grant. Either by being smart or fearful, for whatever reason, we really have, other than passing those social host ordinances 6 years ago, we've done almost no policy work. And that's true with my colleagues as well, as I'm finding out that there's the confidence level, the fear level, the confidence level's low, the fear level's high about what we can and can't do. So for those reasons, we weren't really doing anything at the state level. And what happened is during COVID, home delivery, the adoption of a home delivery law in Georgia utterly caught us in the prevention field anyway by surprise. In fact, I will tell you that a year ago, I did not even know what home delivery meant, that it was a very real possibility in Georgia. I was in the city of Fayetteville's city council meeting talking about alcohol-infused ice cream and alcohol in movie theaters, which I thought was, I was playing with the big boys at that point. And while I'm there, the mayor of the city said, Michael, did you know that the state of Georgia just adopted a home delivery law for the whole state? And I was embarrassed. And I felt like, how do I not know this? I wonder if my colleagues knew this. So that really was that was the eye opener and the change of that's what pivoted for me. And over the next 6 months, I had conversations with many of my colleagues here in Georgia and found out that very few people, I say no one on this slide, but almost no one was actually minding the store at the state level, even some of the best minds in local prevention. And while we didn't realize it at first, I'm on the third bullet point now, within a few months, we also saw that there was a significant need for policy training at the local level. I saw someone put in the chat box earlier, we can't advocate. And I think that's, if I had to guess, that person's talking about being part of a federally funded organization. And what I'm finding out is that we can advocate. Sometimes, and I'm not an expert in this, but I will tell you that if we're going to have any chance in heck at this game that's being played, we have to learn what we can do, both as individuals and as organizations. And that's outside the scope of this conversation right now, but we're starting to learn about what we can do as individuals, taking our coalition hat off, putting our individual hat on, putting on our alliance hat. There are things we can do, and we owe it to this field to explore what we can do and work together doing that. So in 2020, thanks to a serendipitous conversation with Michael Sparks and Dylan Ellerby, I started learning about these gaps between the alcohol industry and what we were, the kind of defense or offense we were playing here in the prevention field. And there is that huge gap. And I was motivated to explore it further. And Kristen, if you could go to the next slide, please. So I slowly learned about the need for an alliance. I learned that the U.S. Alcohol Policy Alliance and some others in the field I'll tell you about are there for us at the local level and state level, that we don't have to do it alone. We don't have to wade into these waters alone. And that was really important because who's got the time, who's got the wisdom to know how to do that, and we don't have to do it alone. I checked in with some of my other colleagues in Georgia, and I found a surprising number of them were immediately interested in wading into this territory, and that meant a lot. I researched also who else tracks alcohol policy at the state level, and I called people with Mothers Against Drunk Drivers, 2 faith-based organizations that I'm aware of, Department of Public Health, Department of Behavioral Health and Developmental Disabilities, which is our single state agency, the largest recovery organization in the state of Georgia. And I found out that of all those and more, one organization was really minding the store, and that was the Georgia Baptist Mission. And that's powerful because they represent 10% of the population of Georgia. And without cutting on the Georgia Baptist Mission at all, I will also tell you that many legislators not all, many, kind of discount that as by calling the Georgia Baptist Mission a moral mission. And I'm not denigrating that at all, but that's not a public health message. There's no public health message representing at the state level. And I'll skip ahead for a second to say this, that with the help of the U.S. Alcohol Policy Alliance and with another organization I will be happy to share with you about, the Alcohol Action Network. I was given some talking points on a key issue, cocktails to go, and I did muster the courage to testify in the Georgia Senate last March. And after I was done, the chair of the Georgia Senate Regulated Industries Committee, where alcohol bills, most of them flow through, pulled me aside and said, we really need that message. We need that public health message in these conversations. And that was an incredible amount of encouragement to me, who was pretty scared walking in there that I was going to be just shamed out of the room for not being an expert already. But so that voice is really needed. We started to gather and evaluate key data and research, finding out where state level alcohol data really is. And I'll tell you right now, some of those key places are cdc.gov/alcohol, cdc.gov/alcohol. The CDC also helps make the communityguide.org, I believe is their website. The communityguide.org is a place that synthesizes policy research and translates it into what kind of alcohol policies can be the best to pursue. And a third place for alcohol-related data is, and I don't have the website handy right this second, but many of you have heard of the STOP Act. And the STOP Act compiles a lot of state-level information that's very valuable. I apologize for the phone in the background. And could we go to the next slide then? Thanks. We then organized some of these people who were interested in Georgia for some action. And maybe I skipped the first and the second bullets, should really be reversed. Let me skip to the second one for a second. Dylan and Michael provided training to 27 of us in Georgia on this book. If you haven't heard about it yet, it's called Alcohol, No Ordinary Commodity. It's really the scripture of alcohol policy. And it really takes pages and pages of an alcohol policy, types of alcohol policy, and boils it down to 7 types. Who knew there were 7 types? And we learned systematically what they are and where we at the state alcohol policy level might want to focus our efforts. That was a very fundamental training for us to receive. And as I mentioned earlier, the Alcohol Action Network, which is another less formal but also important organization where we in Georgia have received support and encouragement and wisdom and mentoring, and get to sit in on conversations with other people across the country. So we got some base confidence level and some base knowledge from those 2 foundational trainings. We then organized, and I'm skipping back up to the first bullet point, into a loose group. We 27 of us in Georgia received this training on alcohol, no ordinary commodity. And of those, 6, including myself, wanted to be part of the Georgia Alcohol Policy Alliance. So 5 of us 6, our organizations are funded by either the state block grant or the drug-free communities, yet we're committed to finding ways that we can advocate at the state level. So we did launch, we have loose functional roles. I'm the president of the organization, which really means convener. I convene the group and organize some of our next steps. We have a policy director who's kind of the one in charge of tracking the bills and then kind of evaluating which one of the bills that are coming up are the most important for us to address quickly. We have a data director who researches some of the sites that I told you earlier about with the CDC and Stop Grant. Partnerships development, and I'm not going to go all the way down the list, but you can see that we have some functional organization around the Alliance. But I think it's also an important takeaway in this call that it's not critical that you hit a home run and become a 501c3 next month. I mean, there's, of all the alliances I'm familiar with in the United States, they're organized very differently. 501c3s, 501c4s, no organization, purely volunteer. Match the capacity of what your state has at the time. Just be where you are, and that should be good. And then go back for 1 second. I'm sorry, Kristen. You know, none of us were policy experts a year ago when we started talking about this. We had to develop some level of confidence on policy. So we did find a policy intern. We are learning from the Northwest PTTC some analysis there's a policy analysis worksheet. We're starting to systematically take apart a Georgia bill and see where the strengths and weaknesses are. The Alcohol Action Network, the third bullet point. Thank you for underlining like that, Kristen. The Alcohol Action Network puts out some policy briefs, and I bet the U.S. Alcohol Policy Alliance does too, which gives us immediate talking points on what's good or not good about our home delivery bill, our cocktails to go bill, our referendums, and so forth. So we're starting to build our muscles around policy analysis. Thanks, Kristen. If you could go to the next slide. We're taking advice from the U.S. Alcohol Policy Alliance and doing a few things, like just play defense at first. You know, just when a bill comes up, and I really thank Michael Sparks in particular for this, for just saying, and we started having this conversation in February, March, when the Georgia legislature was in session. And for those of you in Georgia, you know we're in session from about the second week of January to the last week in March. So we have a short window. And I just started talking about this with Michael and Dylan in February, and they said, just play defense, pick a bill. I found out what bills were out there. I asked the Alcohol Action Network. I was on a call the next Thursday. They said, here's our policy brief on cocktails to go. And sure enough, I found out that cocktails to go was going to be discussed in the Georgia Senate on Monday, like 96 hours from then. And I took the talking points that were in that policy brief and I went and testified. And I didn't embarrass myself. As I mentioned, something with the universe was aligned in some way, because I delivered the talk. I developed some muscles around this, some confidence. And the Georgia Senate chair did pull me over and said, we really need this. So it was a real win-win. And then another one of my counterparts, Charlotte Spell in Bullock County, testified on the same bill in the Georgia House just a couple of weeks later. So we learned to dip your toes in the water. You got to start by flexing those muscles and taking on this game. We did learn how, in Georgia at least, you can track bills online for free, legis.ga.gov. Hopefully every state has got an online tool such as that, where you can put in a search tool like alcohol and find out all the alcohol related bills. And as I mentioned on the third bullet point, we did testify in the General Assembly in March. Of course, we've got the upcoming session in January 2022. We're doing a lot of things between then and now to build our capacity. We've learned who the key people in the legislature are to develop relationships yet. We haven't made those relationships, but it is the chair of the two regulated industries committee in Georgia are two of the key. We're also connecting with one of our grassroots state organizations, Voices for Prevention, so that we've got some grassroots support around these bills come January. And we're using the power analysis. When you get the training from the U.S. Alcohol Policy Alliance, they'll tell you who some of these other organizations are, and if you don't already know them, this power analysis can give you clues on how to develop those relationships. I think that might be my last slide, Kristen. Is that my last slide?
Yes, that is. So if anyone has questions for Michael Mumper, the brave Michael Mumper, an incredibly relatable Michael Mumper, please do put your questions in the chat. And
Thanks.
speaking of chat, we're going to move on to a chat. This is where you get to participate. So let us know, to what extent are you interested in learning more about starting a state alcohol policy alliance? A lot? Oh, I'm seeing already. Jump right on, Colleen and Jean, a lot. Some, not much or not at all.
And let me please jump in to say, any of you from Georgia who want to connect, we are very collaborative, and I definitely want to tap into your interest. Please send me a message.
Yeah, so for you in Georgia and North Carolina, in the Southeast at least, you don't have to start one. You just want to join what's already there. So you want to make sure you reach out to Michael Mumper and Dylan Ellerby. All right, so we're seeing some, not much, we're seeing a lot. Either you guys really want to do it or you're not quite sure. Okay, Gretchen says yes. So we mentioned here about follow-up session. So let me give you, I'm going to give you some info in just a minute that there is going to be a follow-up discussion. So we're not just going to give you all this great information and leave you hanging, but I'm going to leave you hanging for just a second because we're going to move on. Some next steps for you. Michael, do you want to talk about any of this?
Sorry, I muted myself. So be thinking about this. I mean, we are going to pose the question about whether you're interested in hearing some additional information, but between now and that time, it might be helpful and useful for you to talk to some of your colleagues that you connect with at your state level about this notion. Is this a good time to begin thinking about creating a state level alliance? There are existing alliances in states that are prevention alliances. We have contact with those folks, and they're doing really important work. Often they don't have a policy arm. They're not quite at the place where that group is focused on doing alcohol policy at the state level, or necessarily transferring the technology to do that work at the local level. So for those of you who may be members of a state prevention alliance, that's an opportunity to talk with some of those folks and see if it would make sense to spin off a subgroup that could begin to take on this work. This discussion we're going to be talking about in a moment on Friday is a place for you to ask questions, bring some other members in your state to be part of that. It's not a big webinar kind of format. It's really a discussion that we're going to be having with you, where we get to answer more detailed kinds of questions that you're going to be asking. You know, this is also an opportunity for you to think about who else should be involved in your state. You may be a DFC coalition, Partnership for Success, whatever. Are there other organizations that have a natural shared interest in this issue that may not be necessarily part of your immediate circle of colleagues? When we were working on our tax initiative, and we'll work on it again next year, our allies, and this were the state schools, you know, we had law enforcement, we had other groups who weren't part of this, who then are now part of our discussions at the state level, alliance level. So be thinking a little bit about outside groups. Take a look at last year's legislation. Find out what bills were introduced so that you can begin to see what may be coming next year. What didn't get passed that they're going to make another run on. You know, have some conversations with, if you have relationships with state legislators, now's an opportunity for you to begin asking them, do you know what's coming down the road that we should be thinking about and paying attention to? Start tracking when this legislative session starts, you're going to see bills being introduced. Track those. Michael can tell you a lot about how to do that. We can certainly do that and guide you with that work in the Alcohol Policy Alliance. And think about training. Michael talked about the alcohol no ordinary commodity training that Dylan and I provided as members of the U.S. Alcohol Policy Alliance. We can describe that more on Friday and what that might look like if there's some interest in that. There's tremendous support, and there are significant resources out there to help you do this work. It just requires a few who want to take that, as Michael put it, putting your toes in the water.
So speaking of putting your toes in the water, here's the opportunity we talked about. I've shown you the slide already for a deeper dive into a discussion. And as Michael said, it's not going to be a formal webinar with a bunch of slides. But we may break it out by state. It depends on who is on and how many people are on, but we are going to have people available to answer some questions and provide any more information to you. I'm going to put the link again. It's in the chat. If you want to click on that and go and register for the WebEx meeting, it's going to be this Friday. So it's right before Halloween, but it won't be scary. It's going to be this Friday from 2 to 3 p.m. Eastern time. So do make sure you check that out. And you'll still have the link there in the chat. Here's some additional resources for you. Someone already asked about some contact information. I'll make sure that you get that as well when I send a wrap up following this webinar today. But here's the website for the U.S. Alcohol Policy Alliance, and there's information about their conference that they're going to have next April. So do check that out. Here's the website for the PTTC and the Twitter link for Dylan's North Carolina Alcohol Policy Alliance.
Kristen, can we give a moment to Alicia to talk about the AP19?
Oh, that would be great. Let me pull Alicia in as a panelist. So here she comes. Alicia is again the vice chair of the U.S. Alcohol Policy Alliance. Alicia, can we hear you?
Can you hear me?
Yes.
Great. Thanks. I'll be brief. So I am the vice chair of the U.S. Alcohol Policy Alliance, which Dylan has done such a great job of representing, and Michael, but I'm also the co-chair of the Alcohol Policy Conference. So hopefully you all have seen that we are having our 19th Alcohol Policy Conference that the Alliance is hosting in April. And I just want to flag for this audience in particular, I think this is going to be really valuable for those of you who are engaged in this work to come. There's a lot of sessions that are really focusing on how states can do this work, how this can be done at the local level, how this can be done at the state level, how we move alcohol policy forward. And if we have, a nice representation of state policy alliances, there's opportunities for networking and connecting that you won't get otherwise. It will be in person and we will have COVID protocols in place. So you can hopefully rest assured that safety will be a top priority, but the conference is a really unique opportunity to learn from researchers, to learn from practitioners, to learn from advocates who are doing this work on the ground and moving this forward. So I'll put a link to the chat, to the registration. Early bird registration does end at the end of this year, which is coming up really fast because next week is November. So I encourage you all to look at that. I just want to mention that we also do a pre-conference session called the Advocate Institute, and it's all about movement building and capacity building and how to really move this work forward as a field. We're up against a Goliath of the alcohol industry, and I think sometimes we feel beaten by them, but we have a lot of capacity and a lot of options as a field to make a change and really think about it from an equity perspective as well. So I'll put a link to the Advocates Institute here as well. We keep that small. Alcohol industry is not invited to that. So it's an opportunity for us to really be focused on strategy, engagement, and capacity building and movement building. And Mike and Dylan can say more about that. So I just want to put a plug that I think that this is a really valuable opportunity for folks on this call, and we encourage you to come. Thanks.
Thank you so much, Alicia.
I'll just add to that I don't think I'd be in this field still if I hadn't gone to my first AP conference in 2007 in San Diego. The kind of momentum that I think it inspires is really, really important, both for researchers and for advocates. And as Alicia said, the connections that you can make with both researchers and advocates is really, really valuable. I think it's the best conference in the alcohol, tobacco, and other drug field for advocates. So strongly encourage folks to check that out and find a way to get there if you can.
Thank you, Dylan. All right, well, I'm going to put up the evaluation here. Our SAMHSA really wants to hear your thoughts on everything that the PTTCs do. So this is an opportunity for you to participate in the GIPRA evaluation. You can go to the link. I think Olivia is going to post the link in the chat, or you can take a picture of the QR code. But while we're here, I really want to go through and address any questions in the chat. And I am going to encourage the rest of the panelists to please scroll through and look for any
Kristen,
questions.
while you're looking, I wonder if I might ask a question of this wonderful panel.
Please do.
Great. Well, first off, terrific job. It was really an excellent presentation, and we can see that by the response in the chat. But thank you, Dylan, Michael, and Michael. I want to go back. I would love to hear all three of you, and I know we'll get into this more deeply in the session on Friday, but I think something Michael Mumper said was really important, which is this question of what we can do as individuals and what we can do as organizations. And I wonder if you might reflect on that a little bit, especially what we can do as organizations, what we can do, because I think sometimes the perceived barriers are greater than the actual barriers. We know, in fact, that SAMHSA and CSAP want to see more environmental strategies, which is the category, the CSAP category that policy fits under. So can you reflect a little bit on what folks actually can do with their DFC funding, with their block grant funding, with their other federal funding or 501c3 organizations? So I'd love to hear your thoughts on not only what we can do as individuals, but what we can do as organizations, sometimes with federal or state funding.
Why don't we let Dylan start with that, then Michael, and maybe I'll round it out at the end.
Sure. The lobbying line is an important one for organizations to be familiar with. Depending on your situation, if you mention a specific bill and you take a specific position on that bill and you have a call to action, that's what's called grassroots lobbying. So you're crossing the lobbying line there. If you're asking, say, the public or coalition members, hey, House Bill 753 is out there. It's a really bad bill. Please call, House Representative Brown and, tell her that we don't want this bill. You're engaging in grassroots lobbying, but there's a lot of work that you can do. And obviously, if you directly target that legislator, then that's direct lobbying or their staff. But there's a lot of work that you can do short of that, right? So, before a legislative session happens and you want to train people on alcohol excise taxes, and you're just training people basically on, what the research says, right? And that these are really effective when they're done in the correct way. And then if someone from that training decides that they're going to start a committee and they're going to lobby on this issue during session, then that's up to them, right? And they can use the information that they learned from you during that session. One thing that sticks with me is that most lobbyists will tell you that 90 to 95% of their work is not lobbying. So there's a lot of work that you can do that is short of lobbying. I will say at some point someone does have to lobby. No good law ever gets passed without it. So someone needs to. But there's a whole lot of work that can be done short of that coalitions can use federal funds to do work that is in service of advocacy and education on, research-based alcohol policies.
Michael Mumper, anything to add?
It's like Dylan said, there's so many things we can do. Practicing policy education, learn progressive alcohol policy, develop a dashboard in your state of how your state is stacking up from a policy standpoint. Identify promising and impactful policy opportunities in your state, communicating, developing partnerships with grassroots organizations, collecting data, learning what local policy issues are. That's 6 or 7 right off the top of my head of things we can do even short of lobbying. And I'll pass to you, Michael.
Yeah, so I think this is at the heart of many people's questions, and there's a lot of structural ways that people end up addressing this. I one time worked for a nonprofit in Vallejo, California. We had a lot of federal funding. We also had foundation funding. And at that time, the executive director understood the relationship between working at the state capitol in California in terms of creating space for or making sure that the legislators didn't end up closing the opportunities for localities to do alcohol policy work through creating state preemption. And so we held a small fundraiser, and literally we raised at that organization a little bit of unrestricted money. And that unrestricted money then paid me my time when I needed to lobby to go up and do this work. You know, that was part of a progressive organization. They understood this. They created a little pot of unrestricted money. But the state level organization I was working with at that point, that I mentioned earlier, at that time, there were the California Council on Alcohol Policy, for now GAPA. Folks were members of that. We had over 150 people who paid small amounts of their own personal money. I think they were paying $25 a year. It was walk around money. And they participated and lobbied in that capacity as individuals, even though they were members of other organizations. But so much of the work, conducting policy analysis, identifying and reporting on strategies and policies, promoting evidence-based intervention, educating public stakeholders, building capacity and understanding best practices. Those are all non-lobbying activities that have to happen. Having conversations with state legislators, your own local legislators, council members, county commissioners about best practice. This is work you can do without lobbying. There is a point, as Dylan said, where you need to step over the line, but you create barriers. You take time off if you don't have it, or you raise a little bit of unrestricted money. There are ways to do this. States are doing it. So Mark, I'm glad you asked the question. I think there's a piece in this that as states begin to want to take on this work, that we can dig into it more specifically related to their own specific conditions.
Thank you. Kristen, questions in the chat?
Yeah, I'm looking through. Some of them have been responded to. Alicia has jumped on some of them. Thank you so much for that, Alicia. I really appreciate it. I don't really see any. Maybe people are waiting for Friday. We already have, by the way, 13 people have registered for Friday. So do make sure you get in there. I'll include the registration in my follow-up information to all of you who have registered today, just to make sure that you get it again. So even if you can't attend, you know someone who can, you can get it to them.
I think we could invite another piece of input, which is,
Absolutely.
since everybody is doing sort of paid advertisements, which is great, but tell us your thoughts about what our Southeast PTTC should be doing in this area. Tell us your ideas, and you can email them to Kristen or put them in the chat, you know, for future trainings that you think may, you know, help build capacity in this area.
Yes, we're always looking for information and insight and ideas and input and feedback. Please do reach out. Our contact information is here. Our email, our Facebook page, our Twitter, and our website. Don't hesitate to reach out. We are here for you. We are, by the way, a free resource. We are your tax dollars at work. We offer trainings, technical assistance. There's a link on our website now where you can go in and put in a technical assistance request. It's small, but it's up at the top on the left, so don't hesitate to reach out and let us know what your needs are, and we will respond, get back to you within 3 business days. I don't see
There's a good question in the chat, Kristen. It's
okay.
Asks about the connections between Alcohol Policy Alliance and the American Public Health Association and state level public health associations. So maybe that's a question first for you know, Dylan and Michael at the state level in Georgia and North Carolina. Do those connections exist with the State Public Health Association and APHA and your Alcohol Policy Alliance?
Dylan, go ahead.
Well, the Alcohol Action Network, which Michael mentioned, is organized by the APHA and have done fantastic work in supporting people and organizations in states that are working on this issue. I think in the time of COVID, when a lot of people were sort of, you know, noticing that the sky was falling on us in terms of, you know, negative alcohol policy, the Alcohol Action Network did a really good job of supporting folks. In my own personal experience, we have contacts with folks in public health and are in regular communication with them on sort of epi questions and things like that, updating them on what policies we're seeing, or if they hear of something, but they're not sort of formal members of the organization because of the limitations that they experience being state or county employees. Michael Mumper, anything to add to that?
Yeah, I'll say two things in Georgia that presents opportunities on why we need to strengthen our alcohol policy muscles here in Georgia. The Georgia Department of Public Health does not have an alcohol-specific epidemiologist, which from what I hear from other states is a key focal point for developing epidemiological, more than I can say, strength in the state. So to whatever degree is possible, we're going to advocate for that. Secondly, our Georgia Public Health Association has several sectors, and the last time I looked a couple months ago, none of those sectors was related to ATOD. Now, I'm not a member of that organization, so they may informally fit in one of the other sectors, but I would love to eventually advocate for a ATOD sector of the Georgia Public Health Association.
Yeah, I think that's really important. We have one of the very active ATOD states. I'm not putting this very well. In Maryland, Rami Eck is the president of the state APHA, and she's very, very active in alcohol policy issues. So we have different levels of APHA state by state involvement in alcohol policy related issues. But the national organization is doing a great job of being super responsive to this, and they're deeply committed and are really pulling off the Alcohol Action Network meetings, bi-monthly meetings. So, and in our own state, we have members of APHA who are part of our Hawaii State Alliance. So we see cross-fertilization between these organizations. It's very important for us to be talking to each other regularly, and we are. We also do have a state epidemiologist. We had a state epidemiologist on our call earlier, I think. Kari, are you still on? And if so, it'd be interesting if you could post in the chat box sort of your connection to this work at the state level. There you are. Hi. Yeah, so how are you seeing, if you have a moment, to post the interaction between your role as a state-funded epidemiologist, CDC-funded state epidemiologist, and this work on doing alcohol policy, and the role that you can play, because it is a very important role. And while she's typing, were you going to say something, Dylan?
Yeah, while she's typing, I'll go ahead and circle back to something that I saw in the chat box that I think Alicia handled, and that is the question of if we are an organization or a group. I'll stop right there because Kari was really fast. And go to
Actually, that's Julie.
Oh no, it's Julie. Sorry.
Yeah.
But she is talking about the same thing. So Julie says she's one of the co-chairs for the Oregon PHA addiction prevention section. Our members could really benefit from some of the training that you've mentioned as we aim to strengthen their habits. And there is Kari. Kari says, most of what I'm doing is trying to provide the data to inform policy. I work with local coalitions and our statewide prevention agency. So it sounds like if you were an alcohol policy alliance in Kari's state, then you would have her as a significant resource.
Kari will give you her home phone number.
And Elise says my role is similar to Kari's. That's great. Yeah, so what I wanted to circle back to was this question. It was early on in the webinar. If our organization is doing, broader ATOD, can we be an alcohol policy alliance? So if you're, working on marijuana, you're working on opioids, whatever those things may be, and it's a tricky one because this is a small field and there's not a whole lot of funding for this field. But one of the things that I want to emphasize is that alcohol is, even though it leads with the ATOD acronym, it's the forgotten substance. It receives the fewest amount of dollars typically. It is, though many coalitions recognize it as the #1 issue in their communities, underage drinking prevention, it doesn't receive any sort of national attention from an advocacy funding perspective. So there's this big gap, in opioids and marijuana, really important issues, need to be tackled, need to be taken care of, but are receiving tons of attention. And so lots of times, and this was actually, and I won't speak for Georgia, but this was something that we talked about with Michael was, are you duplicating something that's already there, or when you create the Georgia Alcohol Policy Alliance, is this something new? And so there's a lot of really good work happening in Georgia on in a lot of these other substances, but there was a gap where alcohol policy work was not happening. And so it's kind of a case-by-case basis, but the important thing here is that there needs to be a focus and an emphasis on alcohol policy, because if we're doing all of the substances, alcohol is often the one that kind of gets pushed to the side. And I'm sure those of you who work in this field have experienced that or recognize that. And I don't know, Michael Mumper, if you want to weigh in on that at all, or Michael.
We have really smart people here in Georgia, and there was a lot of focus put on, there has been for many years, a lot of focus put on prescription drugs and tobacco and marijuana. And I didn't realize it, but there was a big gap in alcohol, and I had to ask around and confirm that gap.
Yeah, I think it's important to have an entity that is focusing on state legislation that has the word alcohol in it. And that doesn't mean you can't be part of a larger prevention group. That sort of fits this notion of creating a subgroup in a larger prevention network that has the name alcohol in it. So you sort of subname yourself. That name is important so that the substances are, so legislators know that this is a priority. It's important to deal with.
Good. And and Friday we can talk about, brainstorm different structures and ideas and how that works. The main point there is you want alcohol to be a focus, but there's also flexibility in figuring out how to do that.
Michael Mumper, we had one final question to you. Does your alliance consist of both DFCs and block grant prevention programs, or whoever can join?
Yeah, absolutely. Funding is not a requirement for engagement with us. What helps is interest and a little bit of knowledge, mostly interest.
A little bit of bravery.
Yeah.
All right, well, we are almost at time. I want to thank our 3 outstanding panelists. I really appreciate your time and your energy and sharing all that information today. You guys aren't off the hook for Friday. They will be back on Friday. So if you're interested in a deeper dive into this discussion, a little more about nuts and bolts, please do join us on Friday. And you will get the slides, the recording will be available, and I will also include the link to Friday's discussion should you want to know more. So I'm going to stop the recording.